Thanks so much, Amanda. One pattern that really has been consistently clear since the onset of the pandemic is that it has taken a much harder toll on some groups and communities than others. The pandemic has really exploited and exacerbated longstanding social and economic inequities, putting certain groups and communities at higher risk of exposure to the virus, experiencing higher rates of illness and death, and facing greater financial challenges to the pandemic. I'd like to start today's conversation by asking each of our panelists to speak to how the pandemic's uneven impacts are really reflective of underlying inequities that were already present among the communities that you serve long before we started dealing with the outcomes of the pandemic. Ms. Echo-Hoff, can you start us off?
Absolutely. Thanks for having me. It's so important to think about the fact that this disproportionate impact on communities of color did not start a year ago, didn't start 2 years ago, but for my community, the indigenous peoples of this country, American Indians and Alaska Natives, this started more than 500 years ago. The organization where I'm the executive vice president, the Seattle Indian Health Board, and direct our research institute, the Urban Indian Health Institute, we actually were in Seattle at the center of COVID-19 in February and soon experienced a lack of PPE. We asked our federal, our state, and our local partners for masks and for gowns for our providers. But what we got instead a couple weeks later, we didn't get those PPE supplies. Instead, we got a box of body bags. We're a community health center. We don't even use body bags, but it was such a metaphor and a literal box I saw in front of me of how this country has been treating American Indians and Alaska Natives. When we look at the underlying health conditions that puts our people more at risk for being hospitalized and also for death, we have high rates of obesity, diabetes, cardiovascular disease, and we can trace those back to the first interactions more than 500 years ago of the colonization on this land, and then the non-fulfillment of our treaty and trust responsibilities that have chronically underfunded the Indian healthcare system, which means our relatives have been receiving substandard care, lack of access to food, lack of access to socioeconomic and educational opportunities that have resulted in these chronic health disparities that are putting our people more at risk during COVID-19. And every single day, every hour, I think of the loved ones I have lost and my community has lost, and I grieve for them because we know this didn't have to happen. If only the United States had actually fulfilled the treaty rights and the responsibilities they have to American Indians and Alaska Natives. These disparities were built, and this pandemic has illustrated when these disparities are built in this way, they are meant to marginalize, they are meant to harm, and we are seeing that harm right now within our communities. And something has to happen, something has to change. We need our policymakers, we need our allies to step forward and say, this is not acceptable. This is not what the first peoples of this United States deserve, and it's not what they were owed.
Thanks so much for sharing that, those thoughts. Dr. Galvez, can you offer some thoughts from your perspective?
Absolutely. And first of all, it's wonderful to be here. Thank you to all for your perspectives. I am a family physician that works at a community health center that has been taking care of primarily Latino patients for years. And I can tell you that we have a very vulnerable population. Even before the pandemic, our patients really suffered from poor health. This was due to language and cultural barriers, unsafe working conditions, lack of healthcare, lack of access to healthcare. And what we saw during the pandemic is that this is a population that suddenly became essential. While most other people had the ability to stay home, many Latinos were forced to leave their home so that our nation could continue to run, so we could have food on our tables. But unlike many essential workers like myself who had worker protections, who have benefits at work, this has been a group of essential workers that has not been granted the same protections that other essential workers. And this has been going on for years, except that what has changed now is that COVID-19 has unmasked the conditions that this community has been working under. And I can tell you that I have patients that were going to pick berries in July and August in vans, none of them with PPE. Some of them were told they could buy their own PPE. Others were given nothing. And these are the stories that I have been hearing throughout the entire pandemic. People who go to work, they don't have the protections. They're afraid to speak up because they're afraid of retaliation. And then let's also think about the public health guidelines that we give. Stay home if you're sick. You know, if you're a low-wage worker that doesn't have sick leave, staying home for even one day can mean not being able to feed your family. Now, what if you have to quarantine for 2 weeks and you don't have sick leave, or you don't have an employment and you do not qualify for stimulus? This can be financial ruin for many families, which is what we have seen. Low wages also force people to live in multi-generational housing. Families cannot live with a family of 5. We have families that are living, I have families who are living in a small apartment with 10 people. That's actually not bad. Think about the farm workers. You have sometimes 20 people sharing one bathroom. How can you follow public health guidelines when you have these kind of conditions? So these are the conditions that are driving the disparity that we are seeing to COVID, and it has to change. And I can tell you that I am still on the ground talking to my community. Nothing has really changed for this community yet.
Thanks so much. I think that really makes clear how the existing inequities have really placed different communities at different risk throughout the course of this pandemic. And as we start to look ahead also to recovery. Dr. Nichols, have you had similar observations in terms of your experiences and with the communities that you serve?
First of all, I want to thank you for inviting me to speak. We have had very similar experiences. I am the Associate Dean for Clinical Affairs at Morehouse School of Medicine, and also the Medical Director for our clinics. And we've had the same thing. The African American community has been greatly hit by the pandemic, and it stems back to when we were first brought over here to this country. So we have been used for experimentations, as it's seen with the Tuskegee study, as seen with the Henrietta Lacks. And so that has led to mistrust within the community as well with people. Also, you have the same multi-generational types of effects. And most times you see that people of color are often on the front lines when it comes to essential workers working in not only the healthcare, and they might only be the medical assistants or the nursing assistants, but also when you look at who works at the grocery stores and other places where they're first line. And so this impact has affected them from, one, the morbidity and mortality that is associated because of the inability, because of various health issues that people of color tend to have to experience, such as diabetes, hypertension, the heart disease, increased obesity because of the types of foods that they have or the types of exposure by living in a food desert. Also, you see the same effect from not only testing, where some of the testing facilities were located initially made it really difficult to get that, as well as the mistrust of people fearing, what were you going to do with my test results? Then we had to face the next issue was the hurdle of healthcare, because people did not experience the same level of healthcare, where people recently, we had a graduate student who went to the hospital and they told her that, can you read? She's working her PhD. And so this is just the stereotyping that people have and the implicit bias that you experience. And then the next phase was the vaccine distribution, where we've seen a continued level of disparity of people having the ability to get the vaccine, where nationally you see that people of color, if you look at African Americans, are only right now at 6% nationally receiving the vaccine. And the Latinx population and the American Indians are even lower than that. So you see this very large disproportionate with the abilities to even get, plus the abilities of people not having transportation, not having internet access, not having all of the things that is necessary to either go to the hospital get tested and all the others. So yes, this has just made a situation that was already bad worse.
Dr. Erickson, can you point to ways in which underlying inequities and disparities have led to differing risks and impacts of the pandemic for the people that you serve?
Sure, I think I see a lot of the same things that, my co-hosts on this have seen. I work at an LGBTQ youth agency in New York City called Hetrick-Martin Institute, and a large number of our youth are youth of color, and many are homeless or marginally housed. They often live in unsupportive houses or in youth shelters where they get moved around frequently, and they don't have the stability that they need to grow into themselves. Even before the pandemic, the youth we serve were struggling to get their basic needs met, but at least they had places like HMI where they could come if their families were being homophobic or transphobic, where they could spend time with supportive peers, adult role models, people who saw them for who they were, where they could have a meal, do laundry, pick up donated clothes, pick up snacks, charge their phones. We even had paid internships. For many of them, it was their only source of income. And this all in an environment where they were surrounded by people who cared about them. But when the pandemic began, many of our youth ended back up in homes they didn't want to be in. Many were looking forward to graduating from high school, getting jobs, trying to get apartments with friends, or maybe they were already in college and they were forced to adjust to new lives or to move back home. HMI is open normally 6 days a week, and we've gone down to 1 day a week. And that 1 day is primarily now for filling basic needs and picking up supplies. We've shifted a substantial amount of work online, and so have all the other agencies like ours. And our youth used to rely on coming to see us, going to places like libraries, Starbucks, the LGBTQ center, places where they could be inside in public spaces, where they had access to water, bathrooms, Wi-Fi, and all of these kinds of spaces are closed. So instead, because it's cold, they're spending most of their time indoors, often in one room in a shelter or in a family apartment. This may not be a room that they have themselves. They may share it with roommates or siblings. They may have relatives around who are constantly reminding them about their queer identities not being wanted. So this is a point in their lives where they're trying to figure themselves out, to try on new identities. They don't have the literal space to do that. And sometimes they don't even have the figurative space. They don't have the privacy that they need to join virtual programs. They often can't find space in their homes or in their shelters. And the Wi-Fi isn't reliable often in their family homes or in their shelters. So yeah, to sum things up, the LGBTQ youth I see are pretty desperate to participate in their own growth, and they're at an age where they need to do that, and they were just barely making it through before the pandemic began.
Thanks so much, everyone, for sharing those perspectives on these really tough issues. I think there has been really broad coverage of the fact that people of color have experienced higher rates of illness and death as a result of COVID-19. We also know that people of color and underserved communities have really taken a harder hit financially as a result of the pandemic, with higher rates of food insecurity and housing instability. I'm curious, beyond these health and financial impacts, what are some of the other ways the pandemic is affecting people you serve that we may have been hearing less about? And what are the implications for health equity of these impacts going forward? I'm also curious if there are ways in which you think women and LGBTQ people have been particularly affected. And I'll start off with Dr. Nichols.
So thank you. You've seen that this has been affected for women in particular, because what you're seeing is often they are head of households. You're coming from a single parent household in many of the of our communities for people of color. You're coming from multi-generational households where the grandmother might be the person who is supporting her child plus her adult child plus her grandchildren and great-grandchildren and that type of thing. And so the impact that we have seen is that if with the school systems particularly, if they don't have adequate internet service, if they don't have adequate, most of them, many don't have computers either. So therefore, you're already now in a multi-generational home where the person cannot adequately assist their children or their grandkids or great-grandkids with education. Also, the pandemic hit them because they're often frontline employees. And so when that occurred, one of the things that we saw is that if they managed to get COVID because they were multi-generation, has already been alluded to, that meant that they can't work. And so therefore they did not have the access that you typically see because now they can't work. And so they were the sole source of income. So you saw that. And also you have the whole stereotyping and implicit bias that you tend to see, because regardless of what level of education, there's the impression that you might be a very well-educated person, such as what we saw with the physician who could not get care earlier and that died, unfortunately, because they did not, she was trying to tell them that she was having pain and symptoms related to COVID. So often you see that because of that stereotyping of people of color, that you don't get the adequate care you need. Plus there's already the issues, like I said, of many of the disparities that were already present pre-pandemic.
Thanks so much. Dr. Erickson, what kind of impacts are you seeing that maybe have not been as well understood? Have there been any unexpected impacts that you've seen among the people that you serve?
Yeah, so in my role at HMI, I'm part of the counseling department. So most of my coworkers are therapists and I'm a psychiatrist. I prescribe medications and conduct evaluations for housing and other needs. And there are a lot of indicators that when the pandemic hit, our youth members were impacted really significantly in terms of mental health. So we looked at our data for a portion of 2020 during the pandemic and compared it to the year before, 2019, before the pandemic. And we found that clients were asking for much more frequent counseling visits and that I had a third more initial psychiatric evaluation requests. And I'm no longer physically in the office, but I'm busier than I've ever been. My appointments are booked back to back every week, and I'm meeting with youth who are having all sorts of pandemic-related issues. The most common ones are ones that I've named already, like having to spend most of their time in one room at a shelter or a family house and not having privacy. When I meet with youth, they're sometimes in stairwells or closets or outside freezing, when weather permits, whispering or having to get off of calls early. Their Wi-Fi may go in and out during sessions. It's hard to have fluid conversations and really understand what's going on with them. And they talk about feelings that they're really not moving forward in life. This is the time when they should be meeting new people, getting their first job, going to school, and there aren't jobs available. And a number of my clients have actually had to quit school because their Wi-Fi hasn't been reliable enough to participate. And this is even in, city-funded shelter systems where the Wi-Fi should be expected to work well enough to participate in school. My trans clients in particular have run into a lot of health systems issues. So health clinics are overwhelmed, trying to shift to a virtual model. And many of my clients have been having trouble getting in touch with their clinics for refills of their hormones and other medications. And it's even harder for others who haven't started those medications because finding a new provider during this time is really difficult. A number of my clients had surgeries scheduled, and then the pandemic hit and the surgeries got pushed off as hospitals rushed to set up COVID units. Thankfully now some of that is coming back online. In terms of positive changes, there's one area where the pandemic really has helped my work, and that's that there have been these massive changes in regulations around virtual appointments, which weren't really allowed prior to the pandemic. So prior to COVID, many of my youth clients made appointments and then missed them. So I had a lot of no-shows. This was for various reasons. Some of them just forgot about them completely. Some of them forgot until the day of, and then they lived in a far out borough and didn't have time to get in or didn't have the money to get in. A Metro card costs $275. So that's $550 back and forth. Or they needed to prioritize other things like making sure they got a filling meal that day or that they made money somehow. So now I have virtually no missed appointments. All my clients are scheduled for video calls. And if they don't show up, I give them a call on the telephone and they pick up. The other positive that I've noticed is that for trans youth who feared transitioning because of the period of time they would need to spend sort of essentially going through puberty in front of the world, they worried they would feel awkward or people might judge them. The pandemic has allowed them to transition out of the public eye in a little more personal space and to have a little more time to witness the changes to their bodies and adjust before the whole rest of the world gets to see them.
Thanks so much for really highlighting, I think, a range of different ways that people have been affected by the pandemic that we maybe have not been talking about so much. And really any place where we can find a positive during these days, I think is always helpful. Ms. Echo Hawk, what are some of the things you're seeing that you think maybe have not gotten a lot of attention in terms of how your community has been affected by the pandemic?
Yeah, this country has a crisis of missing and murdered Indigenous women and girls and violence against femme-identifying LGBTQ+ two-spirited community members. And we have actually seen that amplified in this time of COVID-19, in particular reports of individuals who then became quarantined with their abusers. And so, or their abusers weren't leaving home for the 8 hours or whatever hours they used to go to work. We're seeing this impact their children, again, because they are quarantined with abusers. Or there is less interaction and less response from law enforcement when law enforcement is called to domestic violence incidences, and in particular in our reservations and villages where they simply don't come at all. And as a result of that, we're actually seeing more increases in violence against femme-identifying people within our communities. We've seen an increase of murders. Nationally, prior to COVID-19, murder was the third leading cause of death for our young women. And this has been amplified by the COVID-19 crisis. My organization recently had the opportunity to speak to survivors of sexual violence in 26 cities across the United States who were urban Indian peoples. And what we found is 20% of them, their biggest concern was the increase of the lack of physical safety for them. And these were already survivors of sexual assault and domestic violence. So this has been a deep increase, and we have seen our community respond and doing all of the services we possibly can. But again, there's chronic underfunding of ensuring the safety of Indigenous femme people across this United States. And we are doing the best we can with the little that we have, but people are more afraid of letting somebody come into their home that may be fleeing an abuser because of COVID-19 and not wanting to expose their families to these possibilities. In addition to that, we are seeing the loss of our elders, those elders who hold our culture and our tradition because of the constant and ongoing colonialism that is looking to eliminate Native people in this United States. We have in some tribes, for example, where there's only 10, 15 fluent language speakers left. And our language is an essential part of who we are in both our spiritual, cultural, and language practices. And when we lose one person, we lose an entire library of knowledge, and those losses have been deeply impacting in our community. I have to echo the positive change in regards to having the ability to provide telehealth services, including to those relatives who are experiencing this lack of safety, are looking to spend time with counselors for domestic violence, sexual assault, also with physicians to talk about the damages to their bodies as a result of these assaults. And with the expansion of telehealth and the changes in the federal regulations, we have been able to provide more services at the Urban Indian Community Health Center that I work at. However, we need to ensure that these are continuous after the pandemic. We didn't just need them in COVID-19, we needed this ability prior. And so we need to make sure any positive changes, such as the expansion of telehealth and the ability for community health centers and others to provide these services, is maintained even after COVID-19.
Thanks so much for sharing those thoughts. And I think I have heard that some tribes have been, in fact, prioritizing elders who speak the native language for vaccinations, very much for protecting the languages and traditions that are at risk, as you mentioned. Dr. Galvez, your thoughts on this?
Absolutely, thank you. And I also want to highlight the psychological impact that this pandemic has had on my community, the Latino community. And I would like to just briefly share with you a story of a patient of mine who I will call B. She is a single 45-year-old female mother of 2 children, and she caught COVID in December working at a meatpacking plant. And even though she was not hospitalized with COVID, she was quite ill at home, and she was in bed for an entire month, sick, short of breath, tired. And during this time, her 2 children had to essentially fend for themselves. She talks about being in a separate room and not wanting to be near them because she was living in sheer terror that she would infect her children. Her 13-year-old had to step up and take care of her 8-year-old brother and mom. They have no family in the area. A friend would drop off food twice a day. And B is now 2 months out from this infection, and she has had to return to work because she didn't have a choice. She lost her job. She is now working at a fruit packing plant, and she still has no benefits. She has not been able to get vaccinated, and she's had to work because she doesn't have sick leave or unemployment. But what I want to highlight here is that despite her physical health not being well, what she worries about the most and what has really hindered her full recovery is this deep guilt that she has. It's a trauma that she has not been able to care for her family the way she feels that she should. She hasn't been able to care for them financially, and she has not been able to provide for them as a mother should, is what she tells me. And she tells me of a story that her son was so desperate to just be held by his mom during Christmas because they had to be separated during Christmas in separate rooms. He put himself in a blanket and just came into the room and just kind of nuzzled against her and then left the room. And she tells me that she closes her eyes and this is what she sees. So absolutely, we have to pay attention to the psychological impact that this has had, and it's hindering people's full recovery. And we need to ensure that people have access to healthcare and mental health services, but this is not happening, even though we have essential workers. And I want to echo what people have said is there have been some silver linings. One of them is that we have seen partnerships grow in our community so that we can bring some services to our patients. We are also Migrant Clinician Network, which is the organization that I represent, is providing a mental health training outreach to community health workers to bring education about mental health to the community. But it's not enough. And as Abigail, as Ms. Echo Hawk said, we're worried about this now, but as people start to recover, my fear is that we're going to forget these people that have been suffering. And we cannot forget this. This is our time. And it's not just about talk. We have to translate this into action and bring policies that actually protect families.
Thanks. And that transitions perfectly into the next thing I'd like to discuss, which is really where do we go from here? So it's clear the pandemic has shown such a bright light on the really stark health inequities that were in place long before the pandemic. And there's now a heightened awareness and focus on them. We're hearing the many ways in which disparities may be widening both today and potentially in the future. But do you see this heightened attention and focus as providing a moment of opportunity for any real progress here? And if so, what are really the most important steps that need to be taken to help close the gaps, not only related to the pandemic, but also to those broader inequities that were in place before it? And I'll go back again to start with you, Dr. Galvez, on this.
Thank you so much. Yes, absolutely. This is an opportunity for all of us, especially advocates of all communities of color, to really stand up and demand. I think one of the things that we need to emphasize is that we really have brought these inequities to light. We've helped the community understand these, but understanding does not necessarily mean good policy. And so we need to start to demand policy. And for the community that I represent, this means healthcare for all. especially essential workers who are on the front lines, making sure that we have food to eat. But we also need to make sure that people who are going to work have safe working conditions. The working conditions in this country are very lax and often not enforced. And right now it's up to the employer then to enforce. We need to have sound policy so that worker protections are enforced and people who do make a complaint aren't retaliated against. We also need to make sure that they have sick leave, hazard pay, access to stimulus money, childcare for people that are leaving their home. So I think there is several policies that we can certainly begin to demand. And I think they need to happen now because we know that another pandemic or another health crisis may hit. And if we don't work on these conditions now, we're going to see the same disparities in the future. It's not only about taking care of the people that we have now, but it's really taking care of our future generations. We know that our future generations, their communities, many of them are coming from communities of color. And all of these psychological and health problems trickle down to the community. So it's an investment in our future.
Great, thanks so much, Ms. Egohawk.
Yeah, absolutely. There are so many opportunities right now, but we have to really think about where and how did these health disparities develop? And we can't have this conversation without talking about the fact that this is from ongoing structural racism embedded in our systems of policy, of resources, of procedures, and everything from policing to the way that healthcare is provided that is directly impacting the health and well-being of our community. And this racism is so deeply embedded that when challenged, folks feel uncomfortable and say, well, it wasn't me. And in fact, as recent as less than a week ago, the Journal of the American Medical Association recently drew a lot of outrage by tweeting, "No physician is racist. So how can there be structural racism in healthcare?" This is one of the leading organizations for medical professionals like myself and scientists. And this is what they're saying about structural racism when we are watching our community, like was mentioned before, a Black physician die as she talked about the healthcare she was receiving that wouldn't listen to her as a Black woman. And I am seeing my community experience that right now. And so even though we are talking about the inequities, we're talking about health equity, because of this structural racism, which was exhibited by the Journal of the American Medical Association in the way that they talked about structural racism, we as people of color in this field are working and have been yelling and screaming about this for decades. We need the allies, the people who like to say equity, but aren't actually implementing it, to step up and challenge with us. It is not just our responsibility to end this structural racism. That is our opportunity right now. And the awareness in the country has been raised, but we have to move beyond rhetoric and we have to take that into action. And if I look at my community, the American Indian Alaska Native community, they should be coming to us right now on COVID vaccine, the entire country, not because they think we have all the problems, but because we have the answers. We have communities that are 70 and 80% vaccinated right now. One of the tribes in Washington is vaccinating all of the teachers in their county. Anybody who is a teacher, because the county is not doing that for their teachers that they are demanding go back into the schools. So the tribes are doing it for them. And we are seeing that across the country. Again, we are leading in vaccinations because we have held onto our cultural value systems of caring for each other for the next generations, because it is our responsibility to be a good ancestor to all people, not just American Indians and Alaska Natives. And we are seeing that evidence now. We need folks to come to us because we have the answers, not because we have the problems, and stop saying equity, put it into action.
Thank you so much. And I think this point about learning from and allowing community to lead is so important. So thank you for those comments. Dr. Erickson?
Sure. I swear I'm an optimist, but I'm also a realist. And I really think that it takes people recognizing the underlying structural inequalities that are there before anything's going to change. And I'm afraid we're not going to learn the lessons we need to learn, and we're going to return to the same or even a worse place than we were before. Because in times of scarcity, the wealthy and the connected kind of always seem to be able to hold on to what they have. And then sometimes I start to think that when the inequality becomes so great that you can't not look at it and it stares you in the face, then we're going to have to act. So I've been riding the subway back and forth to work, and it's a different landscape than it was before COVID. Many of the middle and the upper class people who took the subway during normal times have bought cars, they've bought homes in the suburbs, or they're just staying home in their neighborhoods and going to work on Zoom. They don't have to physically go to work like the majority of lower middle class and poor people who live in the city. So these days, the subways are all essential workers, home health aides, grocery store workers, construction workers, and also homeless people who often have substance abuse issues or major mental illness. And the subway is really rough right now. But the thing is, those people were always there. We were just not seeing them. Maybe because there were so many other people, but now everything is in full view. And I guess I ask myself in whose full view? My fear is that the people who have the power to change things are not the people who are getting on the subway, and they're not the people who are going to see what's happening. I do see some positive changes. There are signs that New York is trying hard to target vaccines to groups that need them the most. For example, where I work up at Columbia, there's a large armory in Washington Heights that provides vaccines. And when the city noticed that a large percentage of the people receiving vaccines were coming from wealthy Manhattan neighborhoods or from the New York City suburbs, they actually implemented changes so that now a large percentage of vaccines are required to go to New York City residents from surrounding neighborhoods like Inwood, Washington Heights, Harlem, and they actually have numbers for this. I was also in a deli the other day. A vaccination outreach worker was going out on foot, scheduling appointments on the spot for people who are working in small businesses. The city's also prioritized those who work in public service jobs. So the staff members at Hetrick-Martin, where I work, have all now been offered vaccines so that we can start working with youth when we can start up again. And as I said earlier, in terms of LGBTQ youth, the opening up of virtual spaces has significantly expanded online support. And I think actually this is going to be especially important for rural youth. I work in one of the, the biggest city in the United States, but, an LGBTQ center in New York City or another large city typically has groups in person. Now everything is virtual. So a youth living in a small town or rural area wouldn't have access before, but now actually can attend these groups with youth from all over the country. And it's all run by an LGBTQ center thousands of miles away from where they live.
Thanks so much. And Dr. Nichols, if you can help us close out with some thoughts on the steps we need to make progress going forward.
So just like my colleagues have said, I have been very happy about many of the progress that we've seen, particularly the attention on telehealth, mental health. Those are things that we're focusing on, that various organizations are showing us, are making statements about what they perceive as systemic racism, and that we need to put an end to these things. But I think the important thing is what my colleagues have said, is that we don't want this to be something that's in the moment, that right now this is the right thing to do because we are seeing the disparities. I want the policies to continue. I want them to put a focus on all populations, for those that are brown and Black people, people of color, for the LGBTQ population, for our American Indians and our Alaskan and our Hawaiian, Native Hawaiians, and every organization, our agents, just not for one population. I want them to look at that we are a country that is a very diverse country, and that we have many disparities with social, economic, and that the focus that we're putting on, that is being highlighted, that we need to get our government officials to look at supporting us and continuing this progress that we have made. And that for the different philanthropic organizations who have been supporting us, and I'm very appreciative of that they also continue this support. And that the various companies who are now offering additional safety, like on the subway systems and in the airports and how they're cleaning, that doesn't just end, but it continues. So I want the progress that we have seen to continue, and for us to try to make sure that it is health equity for all, and that we give people what they need in the amount they need in order to ensure that we all have equal access to healthcare, equal access to different types of benefits, and that we are not just a in the moment time, that this is an always time. And that when also, my final thought is that for vaccinations, that when people's opportunity to get vaccinated comes up, that they take advantage of that, and that we do what we can to protect ourselves and also our loved ones.
Well, I think that's a great place for us to end our discussion today. I wish that we were not out of time, because I feel like we have just begun to scratch the surface of these issues. I really enjoyed having the opportunity to have this conversation and hear all these diverse perspectives on these issues. I think for me, it really hits home that as we hopefully move closer to a recovery from this pandemic, that we must really continue to prioritize and center health equity as part of those efforts. And that is going to be important not only for responding to and continuing to recover from the pandemic, but also for advancing health equity more broadly. So thank you so much for your time and for sharing these really important thoughts today.
Thank you for inviting us.
Thank you.
Thank you, Samantha.